Welcome to The Explainer. Today, we're diving into the incredible, life-saving, and sometimes really risky world of anticoagulant therapy. You probably know them better as blood thinners. And let me tell you, this is a story about a medical revolution that has absolutely changed millions of lives. So let's start with a really interesting question. What if your body's very best defense mechanism could also be its biggest threat? It sounds like something out of a movie, right? But that's the paradox of blood clotting. It's this brilliant, life-saving process, but when it goes wrong, when it happens inside our blood vessels, it can become a silent killer. Okay, so first things first, we need to understand the problem these drugs are trying to solve. What exactly is the enemy here? Well, it's something called thrombosis. And really, it's just the formation of a blood clot in the wrong place at the wrong time. So when one of these clots, or a thrombus, forms and blocks blood flow, it can trigger some of our absolute worst medical nightmares: heart attacks, strokes, pulmonary embolisms. We're talking about a true life or death situation. Now, here's where it gets really interesting. It turns out not all clots are created equal. You've got two main types. Arterial clots, these are the ones that cause heart attacks. They're packed with tiny cells called platelets. But then you have venous clots, the kind you might get deep in your legs, and they're mostly made of a protein mesh called fibrin. And believe it or not, this difference is absolutely crucial. It's the key to understanding how we fight them. All right, so this brings us to the first wave of drugs developed to fight these clots. Let's meet the pioneers, the old guard of anticoagulant therapy: heparin and warfarin. So first up is heparin. You can think of it like a catalyst or maybe a supercharger. It finds this natural anti-clotting protein we all have in our blood called antithrombin, and it just turbocharges it, making it shut down the clotting process super fast. But there's always a but, right? The catch is that heparin is this big, kind of clumsy molecule, and its effects can be really unpredictable from one person to the next. That's why it requires constant, careful monitoring in a hospital. Warfarin takes a totally different approach. It's not a supercharger. It's more like a production blocker. It goes right to the factory, your liver, and stops it from making new working clotting factors. The problem? It's a really slow process, taking days to kick in. And its effectiveness can be completely thrown off by a lot of things, including something as simple as how much vitamin K you get from eating a salad. And that's the heart of the problem with these older drugs. It's a constant tightrope walk. That therapeutic window, the dose that's just right, it's incredibly narrow. We're talking a tiny bit too little and you could get a clot, a tiny bit too much and you risk a major, dangerous bleed. So you can imagine this high-stakes balancing act really pushed scientists to find a better way. It drove decades of research, and it all led to a whole new generation of anticoagulants. And interestingly, the first big breakthrough wasn't a totally new drug, but an upgrade to good old heparin. Yeah, so scientists figured out how to basically chop up the big heparin molecule into smaller, more predictable pieces. They called it low molecular weight heparin, or LMWH for short. And just look at the difference here. It's staggering. Its bioavailability, that's just how much of the drug actually gets into your system, is about 3 times higher. It lasts way longer too. It's so much more reliable that you can give it as a simple shot at home. I mean, this was an absolute game changer for patients. But the real revolution, the one that changed everything, came in the 2010s with a completely new class of oral drugs. Just look at this. On the left, that's the old warfarin routine: constant tests, watching your diet, worrying about other meds. And on the right, that's the new reality with these drugs called DOACs. For patients, the difference was literally night and day. So what's their secret? How do they work so much better? It really comes down to one word: precision. If warfarin is a blunt instrument that just shuts down the whole factory in the liver, then DOACs, they're like molecular scalpels. They're designed to find and shut down one single specific target in the whole clotting process. And these super precise drugs basically fall into 2 main families. You have one type, like dabigatran, that goes right for the final boss of the clotting cascade, an enzyme called thrombin. And then you have the other group, the hexabins, as they're sometimes called, and they target a different key enzyme a little further up the chain called factor XA. But here's the thing. No matter how advanced, how sophisticated, how precise the drug is, every single one of them still faces that same fundamental challenge. It always comes back to that delicate balance. This is the core conflict, right here. The whole goal is to find that perfect sweet spot. You want to turn down the body's clotting ability just enough to stop a dangerous clot from forming, but not so much that you cause a serious, uncontrollable bleed. Every single decision a doctor makes revolves around this constant risk-benefit calculation. So that leads to the most critical question of all for any doctor prescribing these drugs. What happens when that balance tips the wrong way? What do you do in an emergency if a patient starts to bleed? How do you turn these things off? Well, for years and years, reversing warfarin was slow and really complicated. But honestly, one of the most incredible advances in recent medicine has been the development of specific antidotes for the new DOACs. Think of these as a crucial safety net. They give doctors the power to instantly neutralize the drug's effect right when it matters most. When you step back and look at the whole story, you can see this clear, really powerful arc of scientific progress. We're talking about a journey that stretches across nearly a century. I mean, it's an incredible journey. We went from drugs that were discovered almost by accident, get this, warfarin actually started out as a rat poison, to these molecules that are now designed with unbelievable precision. From the really broad, shotgun approach drugs of the 1940s to the targeted once-a-day pills we have today. So when you boil it all down, the story of anticoagulation is really a story of evolution. We've gone from broad to incredibly specific, from high-maintenance treatments that tethered you to a clinic to convenient pills you can take at home. And maybe most importantly, we've built in this crucial safety net of reversibility, giving patients a whole new level of safety and freedom. All this amazing progress leaves us with one final and pretty exciting question. Now that we can target these clots with such precision, could we one day reach the holy grail of this field? Could we prevent deadly clots with zero increased risk of bleeding? The answer to that question? Well, it won't just shape the future of anticoagulants, it could change the future of medicine as we know it.